I have never heard of a compounding pharmacist before. Didn't know what they were, what they did. And it was through my doctor. When I went to her with some issues, she recommended bioidentical hormones, which I was a little resistant to because I like to keep things as natural as I can. But we talked about it, and when I agreed, she said, well, then you need to go see Chuck Fulmer at Partners in Care, and he will compound a specific prescription for you to suit your needs. So I thought that sounded pretty good, and that's what we did. And I worked with Chuck and his staff. We had to make some adjustments along the way. It's not always right the first time. You figure out what you need to adjust. I found Chuck to be very easy to work with. Staff was great. When I had a question or a problem, I could call him, tell him what was going on. He would say, well, maybe we need to adjust this or that. He would talk to my doctor. They would decide to change the prescription. He would mix a new batch, and I would go pick it up.
The relationship between the patient, the pharmacist, and the physician is referred to as the Triad. And it is a working partnership with the physician, the pharmacist, and the patient, communicating to solve the patient's problem. And so much of the solving of the problem is the communication process. I mean, the patient has to listen to their body, how it responds to the treatment. They have to take their medicine as prescribed, because if they don't, we're basing anything we do on false information. And then the communication back and forth, and it is an important part of the process.